Hello, how are we doing today? Good morning, ladies and gentlemen. It is a wonderful, beautiful morning. And this day, with SBI General Insurance, we bring in the right channel of information. Yes, it's the year 2021. Yes, things look a little dull, let's say, even up until now. We really don't know what future holds for us. And as every day, we learn that there is something new about the virus. Hence, this day, ladies and gentlemen, is called Decoding COVID in the current scenario. As we deal with horde of information coming to us, since we call ourselves the information age, we also deal with a lot of misinformation, which perhaps is more scareful and more scarier than the virus itself. And hence, today, we decided to bring in an expert. So, up until now, whatever you have learned, we request you not to unlearn it, but to forget it for a moment. Because today, we will get knowledge from the right channel, from people who know it. Yes, I am an ordinary man. Just like people say, Mango people, we are Aam Aadmi. We get information from Google, from WhatsApp University of Graduation, perhaps, which I think is the biggest source of information for all of us. But today, we're here to tell you all that information that we feed ourselves may not always be right. And hence, it's very important for us to know that the right information should be passed and right information shall be gained. And hence, today, at SBI General Insurance, we do this conference, this webinar, which is called Decoding COVID, with our beautiful extended family. And as you know, we care about you and we'd love it if you share this information to the people you care about. And hence, we make the world a far more beautiful place. Ladies and gentlemen, not wasting any more time today, we are about to have someone who has her expertise for the number of years that maybe I have been alive on this planet. Well, let's put it that way. Her experience is far beyond my knowledge, perhaps many of ours. But to start with the day, I'd like to first of all introduce and thank the senior management at SBI General Insurance who came up with this wonderful idea and executed this for us. We are right now in thousands as we speak, and it's only fair to welcome and thank our wonderful senior management to start things off. Today with us on this webinar, we have the MD and CEO, SBI General Insurance, Mr.Prakash, Chandra Kandpal, PC sir with us. Welcome, sir. Thank you for being here. Along with him, we have the President, Strategic Investment and Head, Open Market, Sri Pushan Mahapatra. Joining them, we have the Head, Commercial Business Lines, Ms. Meena Subramanian with us. Thank you so much for being here, ma'am. And lastly, joining us, the person who's here to give us the right information, we have the Head and Director, Department of Internal Medicine from Medanta Hospital, Dr. Sushila Kataria. Ladies and gentlemen, to start with the day, I would first of all request MD sir to kindly come up on screen and address this wonderful gathering. And before he does that, I can tell you that if you see on the screen, on the bottom, there is an option of ask the question. So perhaps if you have any question throughout the length of the show, and if you have any question, please start putting it there. This day is to answer your questions and to break some myths that exist around this virus in the current scenario being the operative word. Let's start with the show. May you please welcome Sri PC Kandpal sir on screen. Over to you, sir. Here we go.
Good morning. I hope you all are keeping safe and your near and dear ones are doing well. Last 1 year had been unprecedented. We have never seen such times in our life. Many of us not only suffered economically or from job losses, but also lost nears and dear ones. The anxiety, the fear, the stress, worries, and related health issues have impacted many of us adversely. We have learned many lessons too. And the biggest lesson is human resilience, or I can say that human will. I am sanguine that we will come out of this very soon, completely. Let me reassure you that in your thick and thin, we at SBI General will always be with you. As I told you, current times are certainly difficult times, especially for our customers. And at SBI General, we understand this very well, which is why not only we paid our all COVID claims promptly, which were numbering to around 12,000, we also kept people and customers at the center of everything, whatever we did, and we will continue to do so. Be it our customers or clients or employees or communities, they will always remain at the center of our business philosophy. We undertook various measures like covering vaccinations, costs for our agents and POSPs. We arranged for vaccination of our field staff or employees. We launched a drive for including the underprivileged people also for the purpose of vaccination. So we bore the cost of vaccination of such community. We introduced host of activities and measures to ensure physical and mental well-being of our people. Today's session is aimed to break the myths about various rumors which you may be hearing related to COVID precautions. In addition, our team will be touching up on some do's and don'ts. I believe staying informed is half of the battle won. That's the reason we have been conducting knowledge sharing sessions on various issues so that we stay prepared, we stay safe, and stay educated. I wish you health and happiness. Thank you very much.
Thank you so much, sir. Thank you so much. Those were golden words, ladies and gentlemen. As he rightly mentioned, the right information is half battle won already. And at SBI General, that is what we aim at doing every day for our wonderful, beautiful customers that we call our extended family. Moving on, ladies and gentlemen, we have another special gentleman with us, and it'll be our honor to welcome him up on screen. And as we speak, with thousands in numbers, just to tell you all, for a far better experience, you could put us on full screen landscape zone, landscape mode. You could tilt your phones if you're watching on your phone. If it's on the laptop, well, wonderful. Moving on, ladies and gentlemen, may we please welcome the President, Strategic Investments and Head, Open Market, Shri Pushan Mahapatra on screen. Over to you, sir.
Good afternoon, friends. Thank you for taking this time off from your busy afternoon to attend this session. And I can assure you that it will be a very enriching session, a very productive use of your time. It's really great to be with all of you here, though virtually, and I would have loved to be with you physically. And I hope that all of you are staying safe, staying healthy. Your family members, your friends and colleagues are also healthy and safe. And if we look back over the last 15 months or so, it's been a time which we had never either seen or imagined. And I think all of us have learned to adapt. And that is something which is germane to every human being, to adapt, and how well we have. If you ask me 15 months earlier, would I have been as confident? Perhaps not. But today I am much more confident of the future. And I hope with better COVID appropriate behavior and higher coverage of vaccination, we should be in a position to face the future with a lot more confidence than in the last 15 months. One of the things which really stands out, that all of us are parts of large, small, medium businesses. And what is it that differentiates businesses? You have a business model, it can be replicated by a competitor in no time. You have a product, it will be copied by a competitor in no time. What actually is your real differentiator is your people. And that's why I say to my team that it's very, very important to take care of the physical and mental well-being of our teams, their families during these times. And first step towards that is to have the right knowledge about the various facets of these pandemics. And again, because there's a lot of, I would say, uh, I would say wrong information, but I would say inadequate information and appropriate information about the pandemic and the do's and don'ts around it. So what we thought was, why not try and bring somebody who is an expert in this field to talk to you about this? And I'm sure that we would be much wiser and will have some takeaways from this session today. Thank you so much for being with us. Thank you so much.
Thank you so much, sir. Thank you so much. And time and again, ladies and gentlemen, you've heard it. You've heard it from the senior management, both the wonderful gentlemen who've come up and said the same thing, that maybe at times we get inadequate information. Let's just go a little rewind to last year when things stopped. That was the time all of us somewhere thought that how do we contribute to making this a better space? Remember who was out at that time? It wasn't us. We were outside helping customers in our capacity. But on the science part, we had the doctors who would take care of it. Over the period of time, we were filled with a lot of information that perhaps made us feel that now we are adequate. But let's understand, as we speak, science is developing with the virus at the same time. Every day, there is a new learning. Every day, there is a new research. And we are all getting to know new things every day. So I'm not saying unlearn what you've learned. I'm saying have some space to put in some more right knowledge coming from the right person. For that, ladies and gentlemen, may I please welcome on screen someone who is extremely, extremely knowledgeable about this particular context. Today, joining us, we have Dr. Sushila Kataria. Ladies and gentlemen, let's have her on screen. And today we are going to speak about what has to be done right to make sure that we beat this virus. To give her a little introduction, ladies and gentlemen, as you can see, she's the head and director, Department of Internal Medicine from Medanta Hospital. But that's on the part of the designation. Let me tell you something more about her. Over a decade-long experience of her practicing in her field, her area of interest lies in treatment of infectious diseases. More powerful than that is her compassion that she has towards the patients and the passion she has towards making this world a better place. Ladies and gentlemen, she has, as a committed doctor, she has undergone specialized training programs and has attended many conferences held across the country and the world. And for over a year now, she has been giving the right information to the world, and we cannot be more happy about it to have her here with us. Welcome, ma'am. Good afternoon. Dr. Sushila Kataria here with us. How are you doing, ma'am? We'd love to hear from you. Over to you, ma'am.
Namaskar, good afternoon. Thank you very much, SBI General Insurance, for giving me this opportunity so that I can connect with such beautiful people and we can have an exchange of knowledge. In many of the such sessions which I have done, it is always a bi-directional learning. It's never a unidirectional learning. And thank you very much, Aman, for the kind introduction. I am so very happy to be here today and talking to all of you.
Thank you so much, ma'am. We're indeed very happy. Just to let everybody know, you have Ask a Question, which is towards the bottom of your screen. If you can tap in there, feed in your name and ask us questions. I could bring your questions to ma'am. Please feel free to ask us questions that you think bothers you. There are a lot of myths around the virus, and we aim at breaking all those myths today. So ma'am, without wasting any time, let me bring in some questions for you while people write their questions. Just to start with things, with India seeing the second wave, which hit us pretty bad, what do you think the future looks like? And are we seeing a third wave coming in? And how does the doctor fraternity see this coming?
Okay, that's the most important question. So what they say, the $1 million question, is there going to be a third wave or not? So to answer that, we have to understand a little behavior of the virus or any infective pathogen. The virus is not here to kill all of us. If it kills, it can't survive itself also. It has to have a host. So there has to be an equilibrium between us and the virus, which we are gradually achieving. So unless everybody gets immunity, either by a natural infection or by vaccination, the susceptibility remains. By and large, most of the viruses, they become indolent and stay in the community. We are a very, very large country. We have our population, which has neither been fully vaccinated right now, nor maybe we had huge number of infected cases, but still a large number of population is still vulnerable. So the question whether the third wave will come or not will depend on us rather than the virus. The virus will mutate only if it goes into the host. The more it spreads, the more it mutates. And it spreads only if we give the opportunity to spread. So times to come, if we become little irresponsible in our masking habits, I do not complicate it also. So keep your mask okay. Keep your mask well. If we mingle too much, if we avoid wearing masks in public places, yes, there is going to be rise in cases. How many rise will also depend upon how many gatherings happen. But few things will be there, that those areas which were hard hit in the first and second wave will be less affected in the third wave. Those areas where infections were less, maybe some urban pockets, maybe some rural areas, the rise of cases will be in those areas more. I expect that the numbers would start increasing in 2 months' time. And around the festivity, around Dussehra and Diwali, we have to be very, very careful if we do not want to get engulfed by another wave. So stay very, very careful and mask yourself whenever you step out. And the mask should be proper, covering the nose and face both. And I'm sure we will all, with our responsible behavior, will not be caught in a mess like the second wave time. We'll do very well. Ours is a very resilient society. Ours is a very careful society when it comes to health. So I am pretty sure we'll survive better.
Well, that's a silver lining, ma'am. That's a silver lining there. So, as I think, just to put things in perspective, what ma'am really wants to say is we still have to be just as careful as we started the last year. We still have to be equally careful. The third wave picks nobody in particular. It could come back to us. It might not. So answering that question of the third wave, and as you said, ma'am, around the festivities, so we are hoping to be more careful. And as we speak, ladies and gentlemen, do not get lazy even for a second when it's about being careful with the terms. So ma'am, here's the next one. Now, there's a lot of myth around, and we're really sorry. I know how much you have to deal with the knowledge that people have these days, thanks to WhatsApp. My own home has 7 or 8 perspectives. My family would have 7 or 8 perspectives due to some forwards. We've completely shunned out the idea that we take knowledge from WhatsApp because we don't find it as a trusted source of information. Not yet, at least. So here's the thing, ma'am. There's a lot of myth around vaccines. There is, to put things in perspective, there is people are a little still confused and skeptical about which vaccine to go ahead with. What is your take on which vaccine should be taken and about the myths around the vaccine? Because if you break those myths, it makes a major difference. So what's your take on vaccines and which one should be taken?
So vaccination as such has, Aman, it has made our lives better. It started with the Louis Pasteur, but after that, so many vaccines have come. And we are living longer and better only because of vaccines, because in our side of the world, infective diseases are still a major culprit responsible for deaths. So for any infectious cause, most preventive and effective way is vaccination. And the progress which have been made in COVID-19 vaccination has been, it has surpassed all speeds. But at the cost of speed, it has not compromised on the safety and efficacy. Now, more and more data is coming with all the vaccines that they are safe and effective. Any vaccine which is able to prevent, has an efficacy of 50% is considered as a good vaccine. And all COVID vaccines currently available are above 70%. So they fare well, whether it is available in India or it is available worldwide. So most of the common myths, which are like, whether I will not get infection at all after vaccination. No, not. We want all the vaccines to be 100% effective, but still you have to be careful, because you may get infected, but the disease severity will be reduced. To simply put it, 70-80% you will not get it at all. Even if you get it, if you're supposed to have moderate disease, you'll have mild disease. If you're supposed to have a severe or critical disease, it will be a moderate disease. So it will provide you protection. Secondly, there are some unreasonable myths around vaccines, like, people asking about, will the vaccine change your DNA, or it will change your RNA? Will it make you your brain change? Or maybe, some people have come up with excuses like, will it cause infertility? All of that is totally baseless. So if we go to specific vaccines, the 3 vaccines which are currently approved in India, one is Covaxin, which is by Bharat Biotech, which is the oldest model of vaccination. You take a pathogen, you kill it or inactivate it and put in a person. And what is a vaccine supposed to do? It will trick your system to believe that it is under fire by the infection. So it will ready itself with all the armamentariums to fight, considering that it is an infection. So it learns how a foreign substance, or how a pathogen, or how a thief would look like when it comes into your body. So second time, when you get the real infection, it is already memorized and it has already done its drills. So it will be very effective in preventing the infection. So Covaxin model is that. The Covishield is on a vector model, that you take a vehicle. For example, if you have to commute from one place to another place, how would you commute? You'll take a vehicle. Maybe it's a motorcycle, maybe it is a car. So a vehicle which is usually a chimp adenovirus, which is used as a vehicle, you mount on that car, on the vehicle you mount the RNA, which you want to send into the body. So through the vehicle you send it, and then it gets delivered to the right place where it is supposed to be delivered, and it excites the immune mechanism, and you get the immunity by that mechanism. So Sputnik also is a vector vaccine like this, but it is using a different vehicle. So maybe, your Covishield is using car, so it is using a motorcycle, or it is using a different vehicle each time. So one time it will send you on a motorcycle, on another time it will send you on a scooter, so that the body doesn't even develop immunity against those vehicles also. So this is the basic mechanism of these vaccines. Then there is a lot of talk about clotting disorders with vaccination.
I was coming
so
to
yes, so the clotting disorders are actually much higher with the disease itself. So if you don't get vaccinated, and unfortunately you happen to fall sick, out of 100 people who get COVID, 17 have a serious risk of getting a clotting disease. And with vaccine, it is 0.00017. That means out of 1,17,000 people may get minor clotting episodes, which is much less than smoking, which is less than contraceptive pills. So it is really not a real risk. And the real risk is having clotting because of the disease itself. So these are the main issues. But if somebody has any other confusion regarding vaccination, we can address that also whenever people will ask any specific questions.
Well, I think you put things very well, ma'am. We, up until now, didn't really have the understanding of how the different vaccines work. And now I think through your knowledge, we know what's the difference and what to choose and how to choose. And just to say, everything available out there is good. And thank you, ma'am, for clearing out the airs about the blood clotting, because a lot of people who we know personally live with the same myth that there is a lot of blood clotting issue. Thank you for putting that in perspective and shutting out that myth right away in the beginning. So moving on, ma'am, to the next question. We have very recently we have monoclonal antibody therapy approved for treatment. Could it be a game changer? And could you also tell people about it, what this is exactly? Could it be a game changer according to you? What's your take on that?
So monoclonal antibodies have been in use in medical science for last a decade almost. So mono means single, clone means prepared from a single clone. So these monoclonal antibodies look like exact replica, and they have been used for many other purposes, like for malignancies, for immune-mediated problems like rheumatoid arthritis, etc. So now when we get COVID infection, we know some people recover, many of people recover, few do not recover. Why do some people recover and others do not recover? It depends upon their immune response. So some people make good antibodies, so they recover. So what scientists did, they identified those good antibodies and made exact replica of these good antibodies. So this is the concept of monoclonal antibodies. So monoclonal antibodies, there are two mixtures which have been approved worldwide, and one has been approved in India. The one approved in India is casirivimab is one, and imdevimab is two. So that because it is mixed two, then it becomes a cocktail. So people think cocktail therapy is to do with alcohol. No, it is a mixture of antibodies. Why do we use two? Because, you know, even the virus is very smart. So even if it outsmarts one monoclonal antibody, it will be very difficult to outsmart two. So these antibodies, what they do, they bind to the spike proteins. So spike proteins are the sticky proteins which bind to our cells and then, you know, capture and hijack the cellular mechanism. When you give these monoclonal antibodies, they stick to the virus and kills the virus there. It does not let it multiply itself and go to the new cells. It is given early into the disease. So maybe, yes, this could be a game changer. And the good part is that right now, whatever mutants we have, these are amenable to the monoclonal antibodies. Even in future, if the virus decides to mutate to a larger extent, which we call a genetic drift, that it changes its outlook absolutely altogether, then also these antibodies, because these are lab made, which is called a DNA recombinant technology. So it is not very difficult to make a new monoclonal antibody and add to the pre-existing monoclonal antibodies. It will be a matter of a few weeks to few months that you can come up with a new mixture of monoclonal antibodies. This is kind of a passive immunity. Like, you know, you take it and immediately your body is empowered to work. As compared to the vaccine is also important, but the difference between the vaccine is that vaccine excites your immune mechanism. We call it an active immunization, active immunity. So active immunity takes some time after, you know, you get 2 jabs and 2 weeks after that. So it's about 6 weeks that you will be fully prepared to fight. Monoclonal antibodies, on the other hand, starts effective immediately as it's given. That's why it is given in treatment. So it is given in the early stage of the disease. Earlier the better. As soon as you have symptoms, get diagnosed and then take monoclonal antibodies if you fall into the high risk. What is that high risk? Everybody who's above 65 years of age, everybody who's diabetic, everybody who has a kidney or a liver problem, anybody who has unfortunately malignancy or being treated for that, or anybody who has been on a long-term steroids for whatever reason. It can also be given to morbidly obese people, because we saw that obesity is one of the important risk factors. It can be effective for children between 12 to 17 years of age, provided they are above 40 kgs and have either congenital heart disease. You know, some children are born with heart disease. Some people have respiratory or neurological problems. So monoclonal antibodies is the first treatment, actually, which is specifically for COVID. Rest of the treatments have been repurposing. Repurposing means, you know, you brought something for something, but you're using it differently. You know, sometimes it happens in the house. You bought a cloth to make the curtains, but you don't want to make the curtains. You want to use it as a bed sheet or maybe a sofa cover or something. So the medicines are also repurposed in that way, be it hydroxychloroquine, doxycycline, azithromycin, remdesivir, or tocilizumab, baricitinib. These are tongue twister names, but basically they have been used in COVID for different purposes, because we did not have much time to make our own medicine for COVID, because it takes time. So monoclonal antibodies, I personally believe, could be a game changer.
Wow, I think that's a new perspective, man. That's a new perspective, because we don't hear a lot about this, not up until now. We don't hear a lot about this. So thanks to channels like this, people will now speak about it and maybe works in the favor for us. Ma'am, I want to come to a question. By the way, before I get to the question, I see a lot of questions have already come in from the people who are viewing us. Once again, thank you so much for asking those questions. We will very shortly come to those questions. We have close to about 20-25 questions already that have come in, and more are coming in. So whatever question you have, please be rest assured that we will pick it up if it is not repeated. If it's repeated, I hope you find your answers in the same question. Well, ma'am, this brings me to a question that a lot of devastation has happened. This question is divided into two parts. A lot of devastation has happened because of COVID. You know, it could be mentally, it could be just the environment, just people, just our ecosystem, through every aspect of humanity. Also, at the same time, there is this rising question in everybody's mind that when does this end? I know even science is still every day trying to figure out when does it end and how does it end. And going as per the official video of WHO, as I was recently, surfing on the internet, I saw the spokesperson said something, by the time 80% of the world is vaccinated, we have hope that this ends that way. What is your take on that? First, with the devastation, do we have any positives to gain? And secondly, when does this end? What would be your take?
So the most important question, yes, everybody wants to know that when does it end? I think it will behave like most of the infections. So it will not end completely. H1N1, swine flu came in with a big way, MERS-CoV came and all that. It's not that they have gone away completely, but their numbers are not as much that it concerns us. I do get a swine flu case which gets into pneumonia and gets into ICU sporadically, sometimes, few a year, but that's about it, which we call it an endemic, that it has spread into the society and you will have that ikka dukka case coming out. So COVID will also become something like this in few years to come. But because this was totally new, we did not have any counterproductive immunity against it. That means the whole of the world is susceptible. So either we get a natural infection or we get immunity through the vaccines. It will continue to pour up. And as I said, it may not go away completely. When history will be written, it will be written in two parts, I think, pre-COVID and post-COVID.
Absolutely.
So, but it will become endemic. Asking about, even in this devastation, what is the silver lining? The good part is that you see human strength, you see human resilience, you see people coming out from all the ways of life which they had no connection to COVID, and they were not, even anyway, they were not supposed to be working or coming out. There no relation in that area, but they still came and helped people like this. So this tells us about how resilient and how good we are at surviving and helping others. Secondly, it tells us about that something we are overdoing. It tells us about how we interact with the nature. And it has also made governments realize that health is an important sector. It has made people realize of their own space, that there should be a personal space, which is called, we say that, thoda distance rakhiye apne dusron se. And mostly, now we have prioritized health. Health is always taken for granted unless we lose it. But now I think the future health policies, how we see the world, it's going to be changed. And it has changed how we doctors treat patients. Telecommunication, now we're talking, we all of feel as natural, that as if all of us are in one hall and we are interacting with each other. So it has changed how we use technology. So I think there's a good take from this.
Well, you said something really very nice, ma'am, which you said that health perhaps wasn't taken so seriously up until the beginning of 2020. Let's say in February of 2020, if I had to say health is wealth, people would be like, yeah, health is wealth. But today, if we say health is wealth, it makes a big difference, because we remember just how important it was to survive. Last year, how important it was to survive, because earlier when there was no vaccination, nothing, we were all just at home, and we were only at home. And the silver lining, as you mentioned, was we learned so much about humanity, that no matter in the deepest, darkest points in our lifetime, humanity still existed through belief that we will exist. That time we didn't have anything. We just had a belief we'll exist. And today we're here. So I think that's a silver lining also, that, we stuck through those stormy days and got to these days. So it taught us a lot. And yes, health is wealth now more than ever. So that brings me to the point that you said that history will be divided pre-COVID, post-COVID. Absolutely. I think everybody would agree that, pre-COVID life and post-COVID life would be so different, which brings me to a question, post-COVID issues. Now, again, there are a lot of myths around it, that if you have got the virus, as you rightly mentioned, clotting could be one of the things that happens more through the virus and less through the vaccine, or maybe other pills or smoking or anything. Post-COVID, in the longer span of things, how do we see our body reacting to us having gotten the virus? If we have the virus in the longer run of things, how do we see things changing within us and how do we tackle that? What do you have to say on that?
So people mostly, get out of any viral infection. They feel weak for just few days or few weeks time, and then they feel absolutely okay. That happens with most of the flu viruses or coronaviruses when it happens. But this virus is a little more virulent. Even we are seeing that patients who have recovered at home, but continue to feel fatigue, continue to feel insomnia, inability to sleep. So first and foremost, it is a reality that there are post-COVID issues, but equal is the reality that you will, with good care and with good guidance, you will sail through. No need to feel everybody who's getting out of COVID to feel that, even the post-COVID phase is so gloomy and I have to live with this, or maybe whether I will survive even or not. So 80% of the people, whether they are mild, moderate, or severe, they do good and they regain their basic health by the end of 2 months of their infection phase. But some people continue to feel insomnia, the lack of sleep. So there are good medicine, there is a good help available for that. Sleep hygiene is very important because reducing screen time, going for a light walk, then taking a warm bath, making your room dark and little cold, playing a soft music, or maybe reading a book would be doing good to them. Medication can be prescribed by doctors. Then there is a lot of anxiety people are facing because of COVID or recovery from this. That should also be talked about and tackled.
Yeah.
Important thing is some people may have cardiac issues which can get aggravated. So it is my request to everybody who's recovering, whatever your severity of the disease was, do not hurry into activities too much. But I'm not encouraging everybody to be sedentary also. So do a paced activity. What a paced activity means, do slow, but keep on increasing it every day or every week. Like if you were a marathon runner, so I think you are good to walk for 1 hour once you recovered, but I will not encourage you to go for a 21 run just immediately after recovery. So anybody who's doing a gym and you were doing some bicep groups or something with 100 kgs, start with only 30 kgs and build it up gradually. So sudden activity can release more adrenalines and can be harmful for your cardiac function and all that. Thirdly, a lot of people who had a severe lung involvement, they need a serious pulmonary rehabilitation. Many of patients we have discharged home on oxygen. So we teach them how to take care of their lungs, how to do general activity. And not only lungs, once you are inactive, all your muscle groups become a little weak, or maybe, we call it a disuse atrophy, that if you haven't used any of your muscle, it tends to become weak. So there has to be a holistic activity done in a structured manner, and it has to be increased on a regular basis. And do take your medications, whatever has been prescribed. Thirdly, if there is an increased chance of infection because of lowered immunity, because of virus, or maybe medication sometimes, which are life-saving medications. So be careful about any viral or fungal infection. So if your doctor has prescribed you steroids, only take them. Don't self-medicate yourself just to feel good. And if it is required, if the doctor feels so that it is required, then do take it. Because do not stop a medication because it can cause a possible side effect. A possible side effect may be 1 in 1 lakh. But immediately, steroids have been helpful in preventing deaths. This was actually the first medication. So very good medication, but double-edged sword. Whenever it is prescribed, only then take it, and do take care of your baseline health conditions like diabetes, hypertension, or heart condition. And it is the matter of being careful and, be vigilant about it. Don't be fearful of this. Don't be paralyzed because of the fears.
Yeah. Ma'am, that brought us to a very important point. I read this somewhere. COVID in the mind, COVID in the thoughts, but no COVID in the body. As you also rightly mentioned, don't be fearful about it, be careful about it. There's a huge difference. It might sound like a simple line, but there's a huge difference where people believe, oh, any small thing today can be taken as, oh, mujhe COVID ho. You know, if I have, let's say, if I have a mild fever or something, so COVID as a fear is far more than what it exists in human body. So that, I think you very rightly put there, that let's not be fearful about it, let's be careful about it, and that's the way to go ahead. Ma'am, by your permission, I think we'd open this to the audience forum, because there are a lot of questions that have come in, and the further questions that I have are anyway somewhere closely linked to the audience questions. So are we fine with going ahead with the audience questions now?
Perfectly. I think, yes, we should have more of interaction with the audience.
Absolutely, absolutely. So to everyone, we try to keep the answers very crisp and very precise, because there are a bunch of questions that have come in. And let's not forget that ma'am is in the hospital as we speak. And let me tell you, before the show started, she had 10 minutes. She attended another patient and came back. So time is very precious. So we are very much grateful for that, ma'am. You've taken out time. We're not going to misuse that. We'll try to keep it very crisp and very precise so that we move on to the next question. So here we go. There's the first one that has been asked is, for those infected in the first wave, treatment was experimental. In long term, could it affect the long-term health of those infected?
So good question. Experimental does not mean that these medications are all totally new for the system. The safety of these medications have been observed in other conditions also. Like in the first wave, what would we use? You use hydroxychloroquine. We have been taking it for malaria and for other immune conditions for years together, and there are no residual side effects. Similarly, you would take paracetamol. Similarly, you would take steroids or nebulization. So these medications have been studied, and the safety has been proved. I mean, no molecule would be used in human being unless the safety has been proved. Whether it is efficacious or not, time only will tell. So yes, don't be worried. Whatever treatment was given was safe enough. And body has, as I said, time, nature, and patience are three great doctors. So in many patients, that only works. But don't be fearful. Don't have unnecessary botherations. Don't read too much of negative news or anything on the WhatsApp. If you have recovered, if your body tells you that you're fine, and it's been, if it was first wave, then it's been around an year, you're doing good, you'll continue to do good.
Wow. Ma'am, there's a question that comes in from Radha, and she asks that I have painful clots in my chest. Is it okay to take vaccination at this given moment? What would you say to that?
So I think Radha has not clarified what is a painful clot in the chest. She might be meaning that she has some breast related issues. So the safest thing is to go to your primary care physician. But by and large, many conditions which I see are not any contraindication for vaccination. So there should not be any contraindications. But because we do not have specific clinical details of her, go to her physician, go to her primary care doctor and clarify your doubts.
Wow. Thank you, ma'am. I hope that answers Radha's question. There's a question that has come in. We don't have the name. It says anonymous. So I'd request you to put in your name so that it becomes far better. There's a question, ma'am, that should breastfeeding mothers take the vaccine? And also, let's say that they are infected by the virus. Is it safe for them to breastfeed their children at that point of time? Or how does it work? If you could put a
very good, excellent question actually. So to the first question, yes, now even DCGI and ICMR has cleared the air. It is absolutely 100% safe for a lactating mother to take vaccine. Yes. Now the second question, whether continue to feed once get infected, yes. Another, that is a big yes for that. Just wear your mask, wash your hands properly before you feed the child, because the kind of nurture and nutrition a child gets from mother's milk is far better than the top feed. And secondly, even the mother will also get, if she's been feeding and the breast gets engorged, that can be harmful for her also. So it is safe to feed during the illness phase, but you have to be careful that you wear an N95 mask covering your nose and mouth and chin, and wash your hands before feeding the child. But do continue to feed. If somebody is running very high grade fever, wait for a few hours till the fever comes down and then you can feed. Hydrate yourself very, very well, because the fever causes dehydration and so does the lactation. So increase your fluid intake by 1 or 2 glasses.
Yeah. Wow. Thank you, ma'am. I think a lot of women have asked this question. And, this seems like the question that has been worrying a lot of people. Thank you for clearing that out, ma'am. As while we were speaking about vaccination, when we were having the discussion about vaccination and blood clots, there was some gentleman who'd asked a question that said that, yes, we agree that post the virus, we could have blood clots because of the virus. What if we've had blood clots before we were infected? What are the, how proactive can we be, and what can we do about those situations? Because his question is that it might just aggravate through the virus. So what if I already have clots? What do we do with that then?
So most of the patients who have clotting problems like pulmonary embolism, deep vein thrombosis, or mesenteric artery thrombosis, they are aware of this and they're already on blood thinners. So those blood thinners have to continue. Now comes the question, if somebody gets infected with COVID, does everybody with COVID needs a blood thinner? No, that's the guidelines suggest that only those patients who are on oxygen therapy get admitted to the hospital, they must be given blood thinner appropriate to their condition. That could be a tablet, that could be an injection. Exactly for how much duration they should take blood thinners, that is still the science is debating, but at least for a month after recovery, the blood thinning tablets needs to be continued in patients who have high risk conditions like diabetes, smoking, obesity, previous heart disease, or situations like this.
Yeah. Ma'am, there is a growing fear, and as I read the questions, it just establishes itself even firmly, that people are now asking that donating plasma at one point of time seemed like the right thing to do, up until lately when we realized that maybe it's not the best way of going ahead with the treatment. So the question here is, as you already mentioned, but I would like to still, request you to put some light on it, that whatever we are doing now, what is the guarantee that it'll work in the future? Bringing in the plasma reference, this is what the gentleman has asked, that plasma once seemed like a great option. Today, it's not. What are the chances? What is the guarantee what we're doing today is going to be practiced tomorrow? If you could put some light on that.
I wish we could see the future and that. But only thing in, not only in science, but only thing in life which is constant is change. And it's not like one thing failed. We found something better. We do it all the time. We start moving when we get employed. We start moving the best thing, which seems to be a two-wheel. And then we find that two-wheeler are far more risky, because the accident, if happens, it causes more fatality. You move on to a car. Then you move on to a car with airbags. And then probably you want to move on to a car which navigates so well that it takes care of the traffic in future, in front and behind and all that. So it is improvising. It doesn't mean that whatever you did was wrong, but you found something better. So this is what it is, and it is going to evolve. We started with those bulky landline phones and the computers, and now you come to a stage where your smartphone has more memory than the whole of the world computer at one point had. So it is evolving, it is a change, and I am happy that the things which we are working, we are finding something better and we are changing. So that is evolution. We have changed, our technologies are changed, so does the medication, because you are always striving for perfection. You're striving for something better. If that wouldn't be, the world wouldn't progress.
I like the way how you just related things, and change is inevitable. Change is inevitable. Nobody can foresee the future, as ma'am rightly said. Now, this brings me to a question that could have maybe 3 parts. So I'll try to frame it really well for you. Pooja asks this question that, 1, how long is the impact of the vaccine? And that's one, because recently we had heard once again from the WhatsApp University of Graduation, as I like to call it, that there could be a time that we might need to take more boosters, or maybe the vaccine is only effective up until few months or few years. That's one part of the question. Second part of the question is, when we take the first jab and the second jab, what is the ideal time? And does it differ vaccine to vaccine? And third part, which is that if we have taken the vaccine and now I have contracted the virus, what is the time for the third one? So I will bring one by one. First is, how long does the impact of the vaccine last? So if you could throw some light on that.
Okay, so the whole vaccination process in the world started in December 2020 with the UK. UK was the first one to do that and US followed it. So whatever experience we have is only of that. We can speculate depending upon our past experience of other diseases, but what happens to this specific time only will tell. But most of the time the vaccine related immunity is lasting for 1 year at least. But that is variable. Somebody who's young like you would have a more robust immune response with a vaccine than somebody who's 84 years of age with immune compromising conditions. So this is variable, but by and large, it stays for an year at least. And what happens after the next year, we'll get to know when it comes. Now, they say it's not only the antibodies, there are memory cells, which will remember it forever. Because all those people who got infection in the first wave, there were very, very, very few who got it second time. And even their first or second infection was somewhere doubtful but when we try to do the gene sequencing. Yes. So what happens in most of the infections, like if you got chickenpox in childhood, it's a very, very rare chance that you will get it ever again. If you got a chickenpox vaccine in your childhood, there is a little higher risk than the infection itself, but the immunity stays. This should happen with this virus also. But for sure, we'll get to know as the time would pass. But the basic principles of infectious disease do not change that much. So maybe it will either behave like influenza, where you take a yearly shot, or it will behave like chickenpox. There are only two ways it will go. So that is what I feel. But, so far, whatever experience in India, we start vaccinating on 16th of January, where I got my first dose, and then I got my second dose in the Feb months. And I am a part of a study where we are evaluating the antibody response. Yes, it peaks and then it tends to come down and plateau. That's what we have observed so far.
So to understand this better, you're saying that up until now, as we rightly mentioned in the beginning of the show, that science is growing with time, with the virus. Every day is a new research. So we are not totally shutting out the possibilities of maybe immune boosters in the times to come, or is that what we're going to do? Because that's also a question that is coming in a lot, that would we require immunity boosters? Suppose that, as you said, there are memory cells that might just keep it for the longest time. But there's also a slightest chance that you're hinting that maybe we could need some immunity shots later. Is that what you're also saying?
Yes, that may be a possibility, that every year you will come up with a new jab for COVID, depending upon the variants which are circulating into the system, and you take one with the influenza, and maybe the companies, manufacturers would club it with the influenza.
Yeah. So let me just highlight this, ladies and gentlemen. It's a maybe possibility. What we humans tend to do is start getting fearful about it. We are here to discuss possibilities and the recent research. So please do not take it as a firm study and as this is going to happen. No, it's a maybe possibility that we're discussing here. So please.
Absolutely. This is to be clarified, that this is not a possible, this is not 100% that this will happen. So time will tell whether how much robust you maintain, and we see over time, and we are, as we said, we are resilient and we are changing and we evolving. We'll find a solution to that as well.
Yeah. So ma'am, that brings me to the second part. The 3 vaccines available, what is the ideal time gap that we should give between the 2 jabs?
Okay, so with Covaxin, there is no doubt it is 4 to 6 weeks. For vaccines, it is not like, strictly you have to take on day 28. 1 week here and there is fine, because, it's just for the convenience, for the part of protocol it has been made. But if somebody has not been able to take for up to 6 weeks because of any reason, then we tell them, you take it whenever you can. Okay. But 4 to 6 weeks is for Covaxin. For Covishield, it is 8 to 12 weeks. And for the Sputnik one, you can take anything between 3 weeks to 3 months time.
Perfect. And that brings me to the third question, ma'am. Let's say I got the first dose of any vaccine that we have of choice, and now I am affected by the virus. Does that define the course of my second dose, or will I now have to be on the same pattern, like 6 weeks I can take it back again, or should I wait for a longer period of time to get the second dose?
Absolutely. This infection will define your future course of the disease. As we say, natural infection most of the times acts like a second vaccine. So somebody who's taken one vaccine, gets infected, has very good antibodies which are lasting for a long time. This is what we have seen. But for a general principle and to give an answer, whatever you have taken before the vaccine, leave it. You have to take the next dose 3 months from the recovery.
Yeah. So, ma'am, this brings us to again a question which is myth breaking. And I think it's really important because a lot of youth also now speak about this. After taking the vaccine, 1 or 2 days, we are a little dull with sore hand or maybe fever or stuff like that, chills. Now, there are people who've gone on to say that if you do not get those things, the vaccine didn't work on you. And that is something that has been circulating around. So what do you have to say about that? And also, would it also happen post the second jab? Because a lot of people haven't felt it after the second jab. They only felt it in the first one. So 2 parts to it. One, how much true is the fact that if you did not get, because a lot of people say, Mujhe to kuch nahi hua. I took my first jab and I didn't get anything. But my friends had like 103 fever. So again, how do we differentiate this? And is it true that if you don't get it, it hasn't worked?
Okay, so that amazes me and surprises me that people are really very good observers.
Absolutely.
They are. I mean, this is what the part of our research was. So we in the hospital did a research on 4,500 employees. Wow. And we found that at that time in the hospital, only COVID shield was available with us. So everybody was given COVID shield. And with the first jab, 50 to 60% people reported symptoms. 10% had to take 1 or 2 days off. Others were fine with paracetamol. The symptoms usually lasted for 72 hours. In rarely conditions, it lasted for 1 more extra day. So we say if somebody is running fever after 4th day, then needs to be evaluated. It has to be something else, not the vaccine itself. Now we got then the second kind, and this was with the first jab. With the second jab, the number of reactogenicity reduced to 10% only. Only 10% reported some kind of symptoms and not as severe as was with the first dose. I was one of those who didn't feel anything with the first or second. But because we're a part of study, so we were gradually monitoring our antibody response. So it is not true that if somebody does not react to the vaccine, his immunity will not be formed. The immunity will be same, don't worry. It is just somebody's immune behavior is different, somebody's immune behavior is different. So no need to get disappointed if you do not have fever and you don't get a day off because of this. Secondly, it varies from vaccine to vaccine also. If somebody has taken a Covaxin, I have found that the chances of fever reactions are less, much less. It's only 10 to 20%. And it is actually a slightly higher with the second dose of Covaxin rather than the first dose of Covaxin. Similar results have been with the Sputnik, but we have not had any first-hand experience with Sputnik. So you get fever, don't worry, take paracetamol, hydrate yourself well, and take good rest. If you do not get any reaction, very good, congratulations, you are the one better off.
So next time if you find someone who tells you that, hey, you did not get fever, maybe it didn't work, tell them I was just way cooler, yo. Just tell them that and rest your case. Ma'am, that brings me to, we're not going to hold you back any further. We just take maybe 3 questions because we know you are also running on a schedule and we are immensely grateful for your presence and time. This one is about kids and hence I think it's very important. There's a gentleman, Ravi Prakash, who asks a question, anticipating the third wave coming in. What do we do as the parent of a child? Children do go out, in the society that we also live. There is the first ones to maybe come out in the evenings are these little guns. So what do we do in anticipation of the third wave for especially children's safety? Because his point is we've now seen the younger ones also getting affected by the virus. So what do you have to say about that and the younger people's immunity and future?
So there is a lot of anticipation about, third wave being a pediatric dominant wave, which I do not believe that it is going to be a pediatric dominant wave because mostly families where the adults got infected this time, the children also had infection. And if we are doing a sero survey, meaning we are measuring the antibodies in the general population. And we found that the children are equally having antibodies. So there is not a chance that it will only all the children will be affected and all the adults will be fine. It will still be a mixed population of adults and children, but we have to be prepared. even if there is something like this. So for children less than 5 years of age, you cannot do anything by making them wearing mask or that, until unless we take care of ourselves. Usually the adults are the carrier of they are the vector of infection into the family, because move out for work or anything like this. So if we keep ourselves safe, if we all the adults around a child gets vaccinated or are safe, observing COVID appropriate behavior, the chances of child getting infected are very less, because schools are not open, especially preschools are not going to open for some time right now.
Yeah.
Children who are above 5 years, 5 to 12 years, we should encourage them to wear masks whenever they go out. And obviously, above 12, we ask they have to behave like adults only. They have to wear masks whenever going out. So, now, there are a lot of research happening on the pediatric front, especially for the vaccination. Maybe in 2-3 months' time, we will have an answer which vaccine we can give and how much will be the immunity. So whenever results are out, we can vaccinate our children. But be assured that we have all the medication which are used in pediatric diseases, any complication which can arise out of pediatric diseases, and it is not going to be a child-centric wave only. So, I mean, that fear has to be dissipated. This time around and last time around, which were less than 18 years of, the number of people affected were actually absolutely proportionately same. So maybe the number of proportion of children getting affected may increase by 4-5%, but it is not that you will have 80% children and the hospitals getting filled up with sick children. It's not going to happen. That's for sure.
Wow. Thank you, ma'am. Thank you for breaking one more myth for us. We have been in our small capacity trying to, decapacitate all these myths around with your presence even more. So, ma'am, this brings me to the second last question that reads, my RT-PCR test report was negative. However, I was having all sorts of COVID-19 symptoms. How much accurate the RT-PCR test is? What do you have to say on that?
Very good and excellent question, actually.
Yeah.
So this also, because no diagnostic test is 100%. We want it to be, but it is not. So there is a condition called a sensitivity and a specificity. Specific, 100% specific means that it will not pick up any false case. If you have it positive, you have it. And the 100% sensitive means that it will not leave anybody who is having disease. It may pick up few false positive ones, but it will not leave anybody with the disease. So RT-PCR is 70% sensitive. That means only if 100 people are getting infected, the 70% will only be picked up in RT-PCR. If somebody had all the symptoms of COVID-19, it's better to isolate and behave like a COVID patient rather than believing the RT-PCR report altogether. We see this scenario all the time in hospital. And because these are the patients who are sicker ones, we do once, twice, 3 times. Sometimes we do 4 times with all the methods from saliva, from tracheal secretions, and then we prove that it is. But false RT-PCR is common, and it is also based on the way the sample was collected. Sometimes if you do a light touch into the nostril, it more likely it will come negative. If you take a deep throat sample and a nose sample very well, the chances of false positivity are also less. Then it also depends when the sample was analyzed. If the sample has been left for 1 or 2, 3 days, then the chances of false negative are high. So if you have symptoms, believe your guts, isolate yourself, and protect people around you.
Perfect. Ma'am, that brings me to the final question. And once again, it took your time a little too longer. So this is the final question. Mridul has this question as suggested by the media and social media around. The trend of wearing 2 masks now as a safety precaution is far more, trending than maybe it trended before. So his question is that if I go out for a jog, if I go out for a walk, if I go out anywhere, how important is double masking? And do you see that as a weapon to beat the virus in the coming waves, maybe?
Very good question, actually. I am impressed. So 2 masks are definitely better than 1 mask, and especially where the chances of getting infected are high, especially any indoor setting if you are. So what I usually do that if I go for a morning walk early in the morning when I'm not likely to meet somebody and it's also an open area, I wear a simple 3-ply surgical mask. If I have to go in the wards to take the rounds, and especially the COVID wards, then I wear 2 masks. And then there is a sequence to which how you wear it. So that you wear the most efficacious one, like the N95 closer to your nostril and the 3-ply surgical mask above it. If you're wearing a cloth mask and a 3-ply mask, then wear the surgical mask closer to your nose, and the cloth mask over and above it. This is a proper sequence of wearing it. And then the fit is also important. So if you are going to a closed area, like where there are going to be a lot of people, there are going to be 50 people, and the ventilation is poor, wear 2 masks. If it is a well ventilated area, then you don't suffocate yourself, wear a single mask. That is how I follow it, and that's been keeping me safe for last 15 months, and that will keep you safe as well.
And we hope that keeps you safe forever and for always, because with the times we've realized that you are the frontline warrior. And we didn't take this opportunity to thank you earlier, but now towards the end of the show, we from SBI General Insurance and all our customers and extended family would like to thank you, ma'am, for all those indefinite hours that you have put in the last 15 months for ensuring that people like us breathe another day and another second. We are very grateful to you, ma'am. Thank you so much to you and the entire medical fraternity and science who's been researching and getting this done. Also on that note, just as you are the frontline warriors, our people at SBI General Insurance have made sure that they go beyond their line of duty to ensure that people meet their expectations with the company and they're not left behind at any point, even during the worst hit pandemic. So thank you so much, ma'am. It has been an immense pleasure chatting with you and understanding the right information. If you would just want to give a closing note, ma'am, what would that be?
Thank you very much. I enjoyed it thoroughly as much as you did, and I am thankful for SBI for the work they are doing. My final closing note is that we are all going to survive. This is just a phase which will pass, but we have to stay wise, wear your mask, get vaccinated wherever you can. Yeah. Be careful, don't be fearful. Mast raho, swasth raho.
Kya baat hai. This kind of just encapsulated everything that we spoke about. Thank you, ma'am. I'm going to use that everywhere on my social media. Mast raho, swasth raho. Don't be fearful, be careful, and keep wearing the mask and sanitize your hands. That's the way forward. And most importantly, as she said, we are going to survive. Don't give up on the hope. There's light at the end of the tunnel. Thank you so much, Dr. Sushila Kataria. Thank you so much. It has been an immense pleasure, ma'am. Thank you so much. And someday, when the world gets to normal, maybe, hopefully, we look forward to having a big party with you, thanking you for this wonderful session. Thank you, ma'am. We hope you stay amazing and stay awesome. Thank you.
Thank you so much.
Thank you so much, ma'am. That, ladies and gentlemen, was a wonderful session by Dr. Sushila Kataria, who perhaps took out time from the most busiest schedule. And as I rightly told you, even before when we started, she attended a few patients when there were 10 minutes left. And that's how busy doctors are. So we are very, very immensely grateful to you, ma'am, for taking out your time and giving this for us and doing this for us. To all the questions in the chat, I hope we've answered most of them. Time did not allow us to do more, but I'm sure that we'll be doing more and more of these webinars or other ways of passing the right information to you. On that note, we'd like to thank the entire senior management at SBI General Insurance, starting with the MD, sir, PC Kandpal, sir. Thank you so much for your love, for your guidance. We have Shri Pushan Mahapatra. Thank you so much, sir. Miss Meena Subramanian, thank you so much. Dr. Sushila Kataria, absolutely, thank you so much. Our team at the back end in Nexus Events that made this happen, and to our beautiful, wonderful extended family, our customers. We're not going to let you down any day, any moment, not today, not tomorrow. We keep bringing in the right information, and very soon we will meet and we will party like it was in the pre-COVID era. Thank you so much, ladies and gentlemen. Stay safe, spread the right information, and swasth raho, mast raho. Thank you so much. My name is Aman Sharma. Have a great day. Thank you so much, ladies and gentlemen.